Hi, my name is Benjamin Tinker. I'm the chiropractor at Vida Plena Chiropractic Center in Calpe. Today I'm answering your questions. And the question for today is your back the cause of your sciatica pain? Well, sciatica is just a symptom. So it describes the type of pain which you have. A bit like the terminology of a headache. It's a headache. It doesn't tell us why you've got your headache. Is it a hangover? Is it a pinched nerve? Is it tension in the muscles? So sciatica is exactly the same thing. It means that there is pain coming from the back, going down into the leg. It doesn't tell us where the pain is coming from. It could very well be coming from the back. These are two vertebrae. In the middle of the vertebrae is a disc. This is the spinal cord, and these represent your spinal nerves. These nerves in the low back go all the way down the leg, on both the front and the back of the leg, to form both the femoral and sciatic nerves. If there is a movement of one of the vertebrae with respect to the other one, it closes the narrowing for the whole, can pinch the nerves, where is the nerve? Can pinch the nerves and cause pain down the leg. Sometimes the bone twists just to the side like this, and it will just pinch one side. Sometimes it goes backwards and down, backwards and down, and can pinch both sides. Sometimes the vertebrae moves in a different position, allowing the disc to herniate. Lots of people come in with this type of pain going down their leg, and they really believe that their disc is a problem. Now, the disc may well be a problem, the disc may well have herniated, but that doesn't necessarily tell us where your pain is coming from. All of these questions here are only answered by doing a thorough examination, which is why at Vida Plena Chiropractic Center, we're always doing an examination before you start care. What consists of the examination? Well, it's a physical exam of touching the vertebrae, feeling exactly where they are, feeling what area of your spine is in pain, feeling how the muscles are responding, because if you've got a twist of the bone like this, then the muscles are going to be pulling here and they're going to be shorter on this side. Sometimes we need to send you for some x-rays to see the exact alignment of the spine, to see if you've got any degeneration in the joints, to see the quality of the bones. That will change our technique or the angle which we're adjusting your spine. An MRI might be necessary, a magnetic resonance image, to be able to see how good the discs are, if there is a hernia, or if there is any encroachment upon the nerves. Doing reflexes, checking muscle strength. A lot of people who do have sciatica feel weak legs. They feel their legs are heavy. They feel that they're not responding as they should do. Sometimes you get a drop foot. And that's all signs that the nerve is affected. This is the worst case, that the nerve is affected. Moving on from just the back, what else could be causing back pain? Sciatica pain. Well, that could be you literally just sitting on something like your wallet for a repeated time or repeated situation. So 8 hours a day, 7 days a week, you're sitting on your wallet in your back pocket. Now the sciatic nerve goes through the buttocks, and if you put a wallet right there in the middle, you can see how that's going to irritate the nerve. So that's one cause. It's called hip pocket wallet syndrome, and is not very common. I have to say it's not very common, but it does happen. It's more common that the wallet twists your spine out of alignment, and then the twist of the spine causes the pinched nerve. Another cause is just simply muscle tension. There's a phenomena called trigger point. There's a trigger point in the muscle, and when you touch this trigger point, it can cause pain radiating in different areas. So normally these are around the piriformis muscle, maybe the glute medius muscle, and when they are contracted for a prolonged period of time, they can produce sciatica type symptoms. Another thing that can produce sciatica type symptoms, which doesn't really affect the nervous system in the sense that it's pinching the nerve, is a stuck or a misaligned pelvis, so a sacroiliac joint or the SI joint. That can be stuck, irritated, inflamed. You can have sacroiliitis, this kind of thing. And that also refers pain down the leg. However, in that case, it normally doesn't go all the way down to the foot, and sometimes it hangs around the knee area. So that kind of summarizes all of the possibilities of where the sciatic pain can come from with regards to the musculoskeletal or neuromusculoskeletal system from the back down. There are other causes, obviously, of lots of. You could have a cyst, you could have a tumor, you could have damage to it via trauma. Lots of other reasons as well are there, but just going back to that point of doing the thorough examination so that we know exactly what is the cause, so then we know the appropriate care for you, or the appropriate treatment plan, or the appropriate exercise plan, or what have you as the time goes on. Thank you very much for listening. My name is Benjamin Tinker, and I hope you get your back sorted soon. Thank you very much.